sabi ko, no?
Well, good afternoon. Thank you, Secretary Clinton, for joining us here in Los Angeles, California. We welcome you, and we wanted to let you know that we really do appreciate you coming and talking with home care providers from all across the different states in the United States, okay? My name is Regina Sutton, and I am a home care provider. I have been providing home care for the last 10 years for Karen Johnson. Before I started doing home care, I owned a home care organization, and when the recession came, I had to stop providing that service, having that company for myself. And then I met Karen, and I was able to start caring for her. I was always introduced to it by sending others out to do the care, and when they couldn't go, I would care for them when my employees couldn't come. So it was a pleasure to meet Karen and already being familiar with how to care for someone. So I've been caring for her again for the last 10 years. And the one thing that during the time that I've been doing this in-home care that has helped me is my union had started a training program. And this program provides the ability for us to be able to learn how to be care teams. And that is me as a provider and Karen as the consumer, and her physicians and her therapists and whomever. We all come together and we make sure that we know the needs that Karen has so that we can all do it together. Her pharmacists know me very well. I can go pick up her meds and that kind of thing. So I think that that training was very beneficial in making sure that we're able to provide the care that a consumer needs, so it lessens the hospital visits and the emergency room visits. So again, I thank you very much for being in the presence of us, and we're so honored to have you here today. And again, that's my consumer, Karen Johnson.
Hello, my name is Karen Johnson, and I am just happy to meet you. and I feel like I'm one of the blessed people that has a healthcare worker like Regina. When we first met, it was at a food ministry at a church, and I just had a feeling initially, just immediately. And so I said, I'm going to try this. And so we tried it, and she's still here. And like I said, like she said, all my doctors know her, and the pharmacists know her, and it's just good. I've had other workers before, but they were not good, too many problems. And so I was kind of leery about getting anybody else, but I knew I needed the help, so I just spoke to her. And the biggest thing is I feel that she does so much, and as well as she does it, and I know a lot of them do, that they do need an increase in pay because there's a lot they can't. They're having a hard time just to take care of themselves, their families, and household bills and provide food. So it's a needed service. And the training, I went to the training with Regina, and it was exciting to me because those things that they were training them are things that are very important, and you need to know. The worst thing to do is to have a care provider and you get sick and they don't know what to do, or they may panic, and the worst thing that causes other issues. So, but I'm just so excited about the training program. And her work. Her work is really, really good. And like I said, I feel so blessed. And then my daughter knows Regina. My grandsons, they call her auntie. So everybody is just excited with her and appreciate everything that she does. Thank you.
And even though the economy has changed, Secretary Clinton, and I do feel like being with someone for 10 years and providing them that care, it's not easy to give them up and to try someone else and see if they'll work out. So I am the team, and always will be. And I also am wondering, have you ever had the opportunity to have some type of family care that you have been addressing at all? And if you have, would you like to share it with us at this time?
Well, first, let me thank all of you for coming together, and as Regina said, from all over the country, because this is such an important issue. It's clearly one that deserves more attention, and Today, we're going to hear from people who are the caregivers and people who receive the care. And I'm excited to hear your stories because I have not personally had that experience, but I have had numerous friends over the course of my life who have had excellent care from dedicated caregivers, sometimes just temporary, sometimes end of life, sometimes over a longer period of years. The kind of 10-year commitment that you two have to each other is something that is truly an amazing tribute to you both. And to be part of, as you say, Regina, the care team. I want to have the chance to hear from everybody, and then I would love to ask some questions and invite questions to me, because I'm hoping that this issue of caregiving will rise higher on the national agenda. Yes. We have an increasing need for caregivers, but unfortunately, what we can afford in families or individually to pay caregivers is often not enough for the caregivers themselves to support themselves and their families. We also, as you point out, Regina, and as Karen echoed, we need more organized training for caregivers, and that's one thing that SEIU has really undertaken, to be sure that when you are in the position of receiving the care or giving the care, you both understand what you're supposed to be doing and what the challenges are, as you rightly say, Karen, if you get sick. So the training aspect of this is something I'm very interested in. So the personal stories, the amount of training, I know that SEIU has pioneered some training programs, particularly in Washington now, which I'm very interested in, and the continuing effort to increase the wages. And there have been several negotiated contracts now around the country, one in Massachusetts, which has made a real difference. But for me, I want to hear directly from you. Nothing replaces that. You can read about it, you can have people 2 and 3 persons removed, but to hear directly from you is what I want to do, and then to have the conversation.
All right, thank you, Secretary Clinton, so much for the opportunity to be here and to tell you my story. My name is Summer Spica, and I am from Minnesota. I have been a home care worker for almost 7 years. I take care of a young girl named Jayla. She has a genetic disorder called Opitz syndrome, and she's also deaf. When I first became a home care worker, there was no benefits of any sort, no paid time off, no retirement plan, very low wages. I found myself standing in the grocery store aisle with a baby on my hip and a toddler, screaming toddler on the floor, having to decide between buying toilet paper and laundry soap. And I don't think anybody should have to make those choices. When somebody knocked on my door to say, what do you think about forming a union? I jumped right on that bandwagon because I knew that for years and years people have been fighting for these things to change and nothing has changed. So in Minnesota, we did form a union for home care workers, and in July 1st, our first contract went into effect, which is very exciting. And one of the things that was most exciting for me personally was the paid time off. I, as a full-time worker, will receive 5 days of paid time off, and in my career of being a home care worker, I've had 2 babies, and both via C-section, and I had to return to work a week after having a C-section. And I just really don't think that anybody should have to make that choice, whether to take care of themselves or put food on the table. Also, on the other side of home care, my husband has multiple sclerosis, and over the last year, his health has declined significantly. So in the past few months, we have had a home care worker come into our home to help us. And as my good friend would say, it's been a game changer for my family. I'm able to have some independence. My husband is able to have independence and dignity. I'm able to spend more time with my children, and it's made a huge change in our life. home care for me means stronger families, and that's very important. And I am committed as a home care worker to continue this fight and ensure that this industry is seen, that we get the support that we deserve and that it's seen as a real job. So thank you so much for the opportunity.
Summer, thank you for sharing your story. How did you get into home care work? And did you work for an agency that placed you in the home where you're now working? How did you come to this particular job?
In my situation, I have a good friend who it's her daughter that I take care of, and her husband died very unexpectedly, and she was left to care for a little girl with some pretty significant special needs, and so she needed help. She had no help whatsoever, and so she asked me if I could do, if I was interested, if I could do this. And first I thought it'll just be something temporary, but I've seen the difference that I make in their life, and she's part of my family. I'm part of their family, and so I'm there to stay as long as I need to.
That's great.
Hi, and my name is LaTanya Allen, and I just want to thank you again for being here to listen to some of the home care workers' stories. I live in Atlanta, and I've been doing home care for my daughter for 29 years. My daughter was born with cerebral palsy. She weighed 1 pound, 10 ounces at birth. I have been caring for her for 29 years without a home care provider. Just 3 years ago, I decided to go to school for it. I graduated and I immediately started being a home care worker outside of my home. I do have a home care worker that comes inside of my home to take care of her. She does get 56 hours a week. And the young lady that I work for also has cerebral palsy. I love the job that I do. I'm very passionate about it. It's just that home care workers don't get the pay that they deserve. I have gotten hurt on the job where there was no workers' compensation. I've even went to work on crutches with a broken bone in my hip and still lift my client without a Hoyer lift or anything. We have no benefits, no vacation, no sick time off. So what I'm asking is for you to please stand by us, walk with us, and help us earn a living wage. And I thank you so much for being here, listening to our story.
Thank you so much. And can you tell me how much you're making now?
I make $8.50 to $9 an hour, depending on the agency. I work for 2 agencies. One pay $9 and one pay $8.50. However, neither one of those agencies, I'm going to say in the last month, have given me a client. So right now, I have no income.
And how many hours a day do you usually work?
With one company, I was working 8 hours a day, but that client, I think, went to another agency, so that left me without her. I was getting 40 hours a week with her, but now I don't have her. I have no income at all. And I was bringing home around $520 every 2 weeks, and that was just enough to pay my car note. My car note was like $450, and I had to pay that because I had to get to work.
Right. Yeah, you don't have a lot of good
Yeah.
mass transit options.
Right.
Right. And how's your daughter doing?
She's doing great. Having a home care provider have allowed her to do an online college. She just got a degree in web design, so I'm so proud of her. And I also thank the provider for being there for her, because whenever I'm not there, that provider is.
Well, since your daughter is now an adult, does she qualify for some assistance that helps pay for the provider while you're currently unemployed?
Well, Medicaid. She has Medicaid.
Okay.
And she does receive food stamps also. Medicaid gives her 56 hours a week. So her nurse comes from 8:30 to 5, Monday through Friday, and from 7:30 until 1 on Saturday. And on Sunday, I have her.
Okay.
You're welcome. Thank you.
Hello, my name is Elizabeth Bonilla. I live in Las Vegas, Nevada, and I've been doing this home care for 42 years. In the 42 years that I've worked, I've been in Las Vegas 22 years. When I came from Massachusetts, I was making $12.95 an hour. When I went to Las Vegas, I had to go down to $10. And here it is today, I'm still making $10.
After 23 years in Las Vegas.
Yes, still not a penny more. I've taken care of patients that nobody wants. Because a lot of times I would walk into the house and there's nobody there, and then I have to find my patient by the stench. You know, I mean, nobody should live like that, but these are the kind of people that I take care of. You know, I go up and follow the stench, get into my patient's room, and then I have to do everything for them, and they give me 2 hours a day to do this. I walk in the room, this person's laying in whatever, and I have to clean them up, get them dressed, take them down to eat breakfast. Then I have to use the bathroom again, then I gotta go back in the room and clean everything that's in there. And then before I leave, in those 2 hours, I have to make them a sandwich or a salad. And that's it. So they're left alone until I come back at 7 o'clock at night for 1 hour to put them in bed. So in the meantime, what does that person do? Nothing, just lays there. And right now, I'm hitting on 60 years old. It's gonna be my turn to be the client. And what is there for me? Nothing. If I quit tomorrow, I have nothing. I have nothing to show for 42 years that I've done in my life working for people. And that's what I do. I mean, I don't give it up. Everybody tells me, why don't you quit? I can't. It's my passion. And I feel for those people that are left in their homes all day and nobody knows what they're going through, but only us. We're the only people that they see. So we're their miracle workers. But my thing is, I don't care how long I've been doing it. When I leave and they give you a smile, that's all I need. I'm okay with that. But that's it.
Do you work for an agency?
Yes. And right now, all they were giving me was 2 to 3 hours a day. I don't have a car. I have to go on the bus. They tell me they can't give me a client because I don't have a car. I told them, I'm sorry, but I see a lot of girls working, and they're all in the bus, and we're all talking amongst ourselves, and everybody has the same problem. They don't say, let me pay at least half of your bus fare. Nothing. They don't offer anything. If I get sick, but I don't get paid. So I have absolutely nothing. Nothing at all. That's what it is. I mean, I had to humble myself. After 42 years of work, I had to humble myself to go to welfare to get food stamps so I could live. And I can't live alone. I have to live with somebody else, a person who used to be my client and didn't even get paid for that because she didn't qualify for it. She got Medicare and Medicaid, but she didn't qualify for home care workers. So I took it upon myself to go every day in between the client, to go to her house every day and help her. I didn't get paid, but I did it anyway because it's my compassion, So she lives with me now. So between her and I, we scrumple whatever money we got. We pay the rent and the bills. And I supply her with the food stamps and we eat. If it wasn't for that, we'd be out in the street somewhere with the rest of the people in Las Vegas that are always out in the street.
Well, thanks for that 42 years of commitment and passion to take care of people. I mean, you're the kind of person we want taking care of people. Somebody who really is doing it because of your heart. And you shouldn't find yourself in the position you're in after working so hard for so long. It's just not right.
Thank you, Secretary Clinton. My name is Susie Young, and I'm a home care worker for about 30 years in Washington State. I live in Spokane. 30 years ago, the clients looked a lot different than they do today. Today, we have clients with multiple medical needs. 30 years ago, all we had was a wage, and it wasn't a living wage. About 12 or 13 years ago, SEIU came into Washington State, and we formed a union. Within those 12 or 13 years, home care workers in our state learned to find their voices. We came out of the shadows. became invisible no more. And we learned to tell our stories and advocate for our clients, and we learned to tell those stories to the right people. And that would be the politicians in our state. It would be the legislators and the governor. Because without them and without their vote, we get no raises, we get no paid time off, we get no gas mileage, we get nothing without the politicians, because we take care of people on Medicaid dollars. So once we started improving our wages and benefits, we testified in front of the State House and the State Senate, and we told our stories. And part of our job is to advocate for our clients, and you've heard that from the workers here today, is to tell their story. We are their voices, and that's what we took to our legislators in our state. We've gained a lot in our state. And just a few months ago, we won the best contract. It was funded in our state. We now have, besides having a list of health insurance for $25 a month, which we had already won, and LNI, which we'd already won, but we now have a retirement plan in our state. We are the only home care workers in this country that have a retirement plan. I am 67 years old, and I continue to work to supplement my Social Security. It's important. I will not benefit from that, but we need to lay the groundwork for the workers that come. Most of us here at this table, we will work until we die. We cannot afford to stop our jobs. Even if I work part-time, we have to supplement our Social Security, and that's where we are. And when our state legislators, and we want to improve our working conditions, we want to improve the quality of care, we wanted better training. And our legislators said, no, we didn't take that. We went out and gathered 300,000 signatures in our state, and we passed an initiative. And we finally got it funded in our state. So now we have some of the best training in the country. We have 75 hours of training. We also have advanced training. And home care workers need to be part of a coordinated team, an integrated team. We have been honored or recognized by the White House because of our training in our state. We've also learned to be very politically active. Whether we are electing politicians at the state level, the city level, or the national level, they need to make sure that they do not cut programs for seniors, that we continue to have senior centers in our communities. We need to make sure that they are about long-term care. One of the reasons why I'm here today and passionate about it, because we have an age wave going on in this country. I'm sure you've all heard about it. 10,000 people a day turn 65. Where is the infrastructure in this country? Nationally, we need to build a 21st century infrastructure in this country, and you need to start with a trained workforce, because what we have in Washington state is not what you have in most states around this country. We need to have a trained workforce. We need to improve our wages and benefits. I hope that you will join with us to make sure that we have a job with dignity, that we have better wages and benefits for our workers. That needs to happen. Our number one job is to lift caregivers out of poverty, and that should be a national campaign to lift caregivers out of poverty. We keep people in their homes, and that's where they want to be. 90% of the consumers want to be in their home. They do better. They're with their pets. They're with their neighborhood. They're in their communities, and that's where they should be able to be, and that should be their choice, consumer choice. And we can do it in this country if we build that infrastructure. We save thousands of dollars, Medicaid dollars in the state, local, federal governments. We do that. But they need to start caring for us too, as we care for other people. We keep people in their homes. We are their lifelines, and we are their support. But we need to have respect for the job that we do. Thank you.
Well, thank you so much. That's a very encouraging report from Washington, because you're right, most states don't have anything like what you just described. The training is key, but also your political action on behalf of caregivers and going out into the community and telling people, you know, here's what's at stake, and we need your help to stand with us. And then, you know, convincing the legislature to pass the kinds of changes you've talked about, Susan. Let me ask you, when you started, you said like 10 or 12 years ago, you started to try to get, you know, a union that would represent your interests. Is that right? And are most of the agencies that employ and place caregivers, are they for-profit or not-for-profit?
So I am with an agency in Washington state. Because we have a union contract, we can track every penny. We make sure it goes to the workers, right? So yes, they can make a profit, but with a union contract, they don't make these huge profits.
Right.
Because we make sure we're fighting for workers. We're not fighting, when I go to the legislature in Washington State and Olympia, I'm not fighting to make sure that they get more money.
Right.
I'm making sure it goes to the workers and we
Right.
improve our lives.
Right. So when the contract was negotiated for higher pay and benefits, who represented the employers? Was it an association or individual employers? You know how that works? I'm just trying to figure out how more states can do what Washington did.
So the employer, like my company, I know that they have their little, like, lobbyists in Olympia, and they kind of work hand in hand with us. We have labor management meetings. It should not be us against them.
Right.
We need to work together. It's about the clients.
Right.
To make conditions better for them. I mean, who wouldn't want a trained workforce?
Right.
So that's better for the employer, and as well as for the consumer, as well as for us, because we want wages to go with the better training in this country. So it's kind of us against, it's working together as a team, as a coordinated team, for the benefit of the clients. Again, we are their voices. Who's going to speak for them?
Well, you also make a very strong point. The work that you're doing actually saves Medicaid money.
Yes.
Because if people don't go into nursing homes or other kinds of long-term institutional settings, if they can stay in their home, you're actually doing a service that should be both recognized and respected, as well as provide the argument for greater financial benefits for the caregivers.
So if you have more of a trained workforce also, and be part of more of an integrated team, we're kind of doing a pilot program in Washington State to prove that we can save more money, Medicare and Medicaid dollars. So instead of going to ERs all the time, if you have a home care worker that can key into what's going on, you call the doctor's office. You've saved Medicare dollars by not going to those ERs. By keeping them in their homes, maybe you've shortened up hospitalization visits also. You've saved Medicare dollars. So constantly, but do we also all the time remind the legislators and the government and the politicians, we've saved you money? Do we have to always point that out?
Yeah, I'm afraid you do. But that's okay, because you've got a good argument you can make. You know, you just say it over and over and over again, and it makes it harder for them to say no.
Right. We're learning.
Yeah, well, thank you for what you and all of your colleagues have done in Washington.
Thank you.
So good afternoon. I'm Kendall Cummings Akers from Springfield, Massachusetts, and I am a home care healthcare worker. And I started when I was 17 by taking care of my own daughter, Jovina, who was born with cerebral palsy and Aicardia syndrome. So I guess that's what made me become a professional home care healthcare worker, to make sure the rights of the disabled were protected. I've been doing this for at least 36 years and 9 years out of the home. And right now, my consumer that I take care of, I have two consumers. One I actually get paid for, and one that I volunteer my services for, because he has a significant other who has dementia. And I love my consumer and Miss Amy. I love him to death. But she needs to be at home. She needs proper care. And she does not qualify for Medicare services because she makes a little too much for Medicare and not enough to pay me out of pocket. So I volunteer my services to take care of her. Where the Western Mass Elder Service told us that they would provide her 3 hours a week, and that's not enough. She needs daily care, and then she needs nighttime care. Especially at night, because she gets up throughout the night. And sometimes my consumer, mind you, I do a midnight shift too. I do 12 to 2. And sometimes he'll call me to come and pick her up off the floor because she's fallen from trying to go to the bathroom. And I think those laws should be changed, you know. On top of that, we have home care workers in Western Mass. Like, we've won our contract for $15, but there are still lots of home care healthcare workers, both in private and public sector, that don't make $15 an hour. they need to have a living wage. So those things like that need to be changed also. Now, this is 2016 is coming, and it's, somebody's gonna be president. And we
Not
need
just somebody. We need to make sure that whoever best represents us, the people, is someone that supports us, the home care workers, the low-income wage workers, our consumers, especially our seniors and our veterans, because we, the healthcare workers, will be out there knocking on doors, making phone calls, communicating with our friends, family, and neighbors to get that word out. Home care workers and our issues should be in the front, right there in the front of the table. And it's hard especially with our Medicare patients, that don't qualify for services. That's not right. There should be some changes in there. Change with the way the Medicare system works and change with the people that make low income. Yeah.
So,
Can I ask you, Kindle, when you said that the $15 wage came into effect, but some workers didn't get it. Now,
Yeah.
why didn't they get it?
well, there are some home care workers that work in different agencies that didn't get $15 an hour. Maybe they're not union yet, or maybe they're just starting their union. Maybe they're still on their fight, but we're standing with them. If we can do it, they can do it.
Right.
It takes all of us working together to make a change.
Right.
And they'll get there. We're gonna make sure they get there.
One of the interesting things is we've heard that several of the caregivers had someone in their own family who had a health challenge that required a lot of care. And many of you cared for your child or your husband, and then went into the labor market as caregivers. And I find that, very touching because, it's as though you, from giving out of love, you realize how much it meant to actually take care of somebody.
Yeah.
And that to me is such a tribute to each and every one of you for doing what you have done under circumstances that I think would be hard for so many people to cope with.
This job isn't for everybody. You have to have a lot of compassion in your heart. You have to have a lot of love, and you want a home care worker that's well-trained. We have our mandatory orientations where the home care workers can go and learn what they're supposed to do. We have our training and upgrade fund. So if your consumer goes into the hospital and you're not quite sure what you have to do, when they come home, you can go to school for it and you can learn to better provide for your home care worker. For your consumer. So there's different things that our union has provided for us, and we take advantage of that. But, this job isn't easy. My job does not consist of just going and cook a meal and doing laundry. I am part of the whole package. When they go to the doctor, I'm at the doctor's office. When the doctor says they need a special diet, I have to do that. When I go to the grocery store, I spend 2-3 hours in the grocery store reading labels to make sure there's only 170 milligrams of sodium in their food, or, so many grams of sugar and stuff. So, and then I'm their nurse when they're home. So, I'm their social worker and their companion, and they still like to go out. They don't want to be stuck in a nursing home someplace. They want to be at home. Miss Ann still likes to go and get her hair trimmed and her mustache done. and waxed and stuff. I mean, she loves her pets, you know? When her husband, her significant other was just recently hospitalized, and she had to go to a nursing home and a rehab center because I couldn't take her home with me. And $250 a day, they can't afford that, you know? And if I could have been there for her, I would have. I did make sure that I went and I visited her so she can continue to recognize me, because sometimes they wind up in a nursing home and they don't have anyone come see them. She doesn't have family here, neither does he. And they get lost. But as long as she's seen me come in there every day and it put a smile on her face, and I would just tell her, Miss Ann, don't worry about it, you're coming home soon. You know, we're gonna get you home. And now she's home and she's happy. And that's where she wants to be. And we wanna keep it like that.
Well, that's also good medicine.
Yeah.
You know, taking care of somebody, showing how much you are interested in them, you know, that all creates a much more positive outcome.
Yes.
For people who have some kind of, condition that requires care. So that's good medicine.
Yes, it is.
Hi, Madam Secretary Clinton. My name is Anthea Peters. I am from Cleveland, Ohio. I have been a home care worker for a little over 14 years. I got started in 2001 going to class to become a home care worker because my father was diagnosed with cancer. And we had already decided that he was going to go through his illness at home. I'd already seen firsthand what it was like for my grandmother to be in a nursing home. And I didn't agree with some of their tactics due to them being low funded or whatever the issue was for the nursing facilities. So we decided that I was going to be my father's caretaker when he got, when his disease progressed to a point where he could no longer do for himself. I moved myself and my 6 children into his 1-bedroom apartment where I cared for him around the clock until the very end. And one of the things that I loved the most was that I think him being at home and being around his things and being able to choose his favorite juice that he liked to put in the freezer with the slush on top, he could have that in his favorite chair with his jazz playing. And it increased him enough to where he lasted 2 years through his disease. And I know that it makes a difference when you're going through an illness to be at home and to be around your loved ones and to have everyday things that you're used to doing happen in your life. You know, my father liked to play the lottery. So when he could no longer walk around, we put him in that chair and we pushed him on to the lottery machine and played his numbers. And, he liked to watch Jeopardy in the afternoon. So irregardless of whether he could change the channel or not, I would sit him in his favorite chair and Jeopardy was on the TV. And I know that made a difference in all of our lives, my sisters and my brothers and my father's life. When my father passed, I continued in the field because I knew what a difference it makes in people's lives to be at home and to be cared for by someone who cares. I currently take care of a 8-year-old boy who has a muscle disease, so he has no movement in his body. And I travel about an hour to get to his house in the morning, and I call him Jack Sprat. He is full of life. To me, he's like any other normal 8-year-old child who wants to get up in the morning and play in his cereal and play with the dog, and then he goes to camp. In the process of me doing that, I have to lift Jack out of the bed and place him into his chair because they don't have a Hoyer lift. So the physical weight is placed on my body. He also goes to the park, where I take him to the park, and there's a swing that, it's the only thing he can do on the playground is use the swing because it's the only thing that's handicap accessible for him. And so I have to literally lift him from his chair and place him into this swing with no assistance. A lot of times it's very difficult because, as we all know, swings, when you sit yourself in them, they push away from you. So it's quite a task on a daily basis to get him into the swing, back out of the swing, back into his chair. He also swims. And so, you know, when we take him to the pool, he has to be lifted out of his chair again and placed into the water, and kind of drifting around, which he enjoys so much. And I love to see the smile on his face at the end of the day, that he had a normal day like any other 8-year-old child. I also attend his physical therapy appointments with him so that his mom can continue to work a full-time job to support her family. And in the same token, while I'm doing this, I leave my 4 children at home alone with an older sibling who has to watch them because I can't afford to pay child care for the number of hours that I have to work to cover my financial needs of my household. And a lot of times when I'm sitting there with my client and we're coloring or we're baking cookies, I sit and I think about my own 8-year-old daughter who's at home without her mom. But I have to do this because this is how I make my living. And I want to do something that's meaningful and that touches people's lives. And this is a job that you have to give your whole heart, mind, body, and soul to. I do that on a daily basis, and I don't feel like it's fair that at the end of the week when I get a paycheck that I have to choose between paying my rent in full or cutting the rent in half so I can go buy my 8-year-old a pair of shoes because she's looking at me saying, "Mommy, these shoes hurt my feet," you know, and or having to even sign up for Shoes for Kids. You know, I work 40 hours a week. There's no reason why I should have to be in this line signing up for Shoes for Kids. You know, I work hard to try to take care of my family with pride and dignity, you know, to show my kids that hard work pays off and that what you do for people is not only rewarding for yourself, but it should be rewarded. Sometimes, you know, even throughout the month, from month to month, between trying to work the 56 hours to make sure that I can cover my rent, my light, my gas, my car note, my car insurance. You know, I've gone 3 months without paying my life insurance because I can't find the money anywhere. I can't work any more than 56 hours a day because I'm already taking that time away from my own children. And, you know, I miss things like after school programs. And my daughter is, I have a 14-year-old daughter who has been an honor roll student since kindergarten. And she recently just made it to the 8th grade, and they had this great ceremony for her, and I couldn't be there, you know, because I had to be at work. Because if I don't go to work, then the lights may get cut out, you know. I have a son who graduated high school this year, and he would have been the first kid in the Peters family to attend college. But unfortunately, due to my income, I can't afford to send him to college because I can't afford room and board. And freshman year, they have to stay on campus. And so he misses out on an opportunity that should have been his. I should have been able to provide that for him, working 40 hours a week, more sometimes, just to try to make ends meet. I need to be able to stay in this field to continue to make a difference in people's lives. Because I know that what I do at the end of the day is making somebody else's life worth living. You know, I've taken care of veterans coming home from war who live at home alone. And they light up when someone walks into a room and thanks them for their service and talks about, you know, their everyday lives and what they've been through. You know, it gives them the energy they need to keep thriving. You know, and for that, that's reward enough for me, but it's not enough for my family. You know, I can't continue to stay in this field and do what I do and make a difference if I can't take care of my own family.
Great. Well, I think your children are very lucky that they have you as their mother. And I hope that you will talk to one of the union leaders or reps who are here to see what can be done for your son. Because there are a lot of opportunities. And there certainly are great community colleges like this one where we are. We're on, you know, know, and we're on the campus of the largest community college system in America, probably in the world. And I think there are 9 locations. And I believe that with some help and guidance, that young man who you are so proud of could begin at least at a community college and figure out how to go from there. So I hope that somebody will help you explore what the options are. Because you have made a lot of sacrifices and you've set a wonderful example of the kind of person that gives back to society and cares for others, for your children, starting with caring for your father. So I know you want to do everything you possibly can to, give each of your children the chance to live up to his or her own dreams. And so I want somebody to follow up with you on that to make sure that whatever can be done will be done. How much are you currently making an hour?
I'm currently making $8 an hour.
$8 an hour.
Yes, ma'am.
Honest to goodness, it's just so wrong.
Yes.
There's no other way to say it. It's just so wrong. I mean, if everybody in the caregiving world, including people who do it for free for their fathers or their children or their spouse, if everybody were to stop tomorrow, what would we do? I mean, if you had to go out and buy the care that is given for free or at a really low, unlivable wage, that would cost many, many, many billions of dollars. And it's time that the country starts recognizing that.
Yes.
I mean, it is very important for your stories to be told because I don't want you to be invisible. I don't want what you do to help other people not to be seen and understood, because it is, as Susan said, the only way over time that you can get the changes that you're trying to achieve. And I just don't think it's right or fair that the work you do, which is so critical to the well-being of the people that you care for, and each of you have said you provide free care as well as the poorly compensated care that you also provide because you see somebody in need. I mean, isn't that the kind of country we want to live in, where people are helping each other, where we've got each other's back, where we're looking out for each other? And yet at the same time, we can't expect you all to sacrifice your own families and to work for an hourly wage that is just totally inadequate. It's just not right that you would have to do that. So we need to keep pushing for a higher wage. It used to be that you didn't get the kind of wage because people really didn't understand what you did. They basically said, well, you're a companion. You show up and you talk to this person and maybe you watch TV with them. They have no idea. No idea.
Trust me.
How hard the work is.
We're not just watching TV.
No. Yeah, but we need to disabuse people of those myths so that they understand when they are in need and they can't lift themselves out of a bed, they can't take care of their personal needs. They don't have somebody to help them, then they go into the nursing home where it's so much more expensive and where it's often impersonal. There's not that smile or that discussion that you have about the lottery or anything else, right?
Yeah.
Exactly.
So I think that this movement to give dignity and respect and better pay and benefits and training to home health care workers is one of the most important missions that we should take on together. And you all are on the front lines, and the rest of us have to be supporting you and advocating for you. Because if you think about the fact that we're going to have more and more elderly people, and we're going to have more and more people with illness and disability who are going to live longer, no matter how young they are when it first happens to them, we are going to face a care crisis. And if we don't do more to think that through and get prepared right now, I don't know how we're gonna take care of people. And it always is, to me, hard to justify people who don't want to pay for caregivers when I think our highest obligation to one another is to take care of each other.
That's right.
So somehow we've got to get the support, and that's what, you know, the union is doing for you, because they're your voice, they're standing up for you. And we need to make it possible for more people to get the higher wages and all the other benefits. Regina, I wanted to ask you, you know, when you were talking about caring for Karen and the years that you have now done that, you said you were part of the care team. And several others have mentioned you are integrated into that. You know the doctors, you know the nurses, you know the pharmacists. And I think that's another important message to get out there, because you're not just isolated over here in the home. You are much more than that. You are the voice, you are the coordinator. You're often the emergency service for the person you're caring for. Could you talk a little more about that, Regina?
Yes, the training program that I went through, it was 17 weeks long, and we had met once a week, and it was provided through my union that we were able to attend this. My consumer was able to go in at the beginning of the class and the end of the class, and if she wanted to come any other time, she could have came. She also wanted one of the books that they provided for us, but I guess they weren't allowing that. But we were able to go in and learn things like the care for them, learn what kind of things to spot on a body that might end up being something that may have go into something like cancer, a little spot. Notice those kind of things. We learn things like a little piece of paper on the floor. Be noticeable about that, because there can be slip and fall. Well, we might be able to bend over and pick it up. If Karen were to stop to bend over and pick up a piece of paper because of her back issues, she may be, go over or tumble over. And so we learn those kind of things. We learned before then, I also cared for a guy that had a G-tube. Well, those are the kind of things that this integration, this training helped us to know, how to do those kind of things, how to minimize for the consumer to have any further problems than they already have, and to help them to not have to end up in the emergency room because they had a slip and fall. Be able to notice that there's a cut and that the color of it is time that you need to call the doctor so it won't turn into gangrene, and those kind of things. So it was very beneficial for us to go. I am so glad that this training class that we had invited the consumers as well, so that they would know and understand how important it is for the provider to be involved in the care team, to be involved with the physicians, to be involved with the medicines that they're taking, so we'll know the medicines they're taking. When I'm trying to pay attention to Karen right now because she had back hurting early and she had to take meds, so I'm having to look at her and notice that she's sweating and maybe she needs the little napkin to wipe. Those kind of things, to pay attention to some signs. And so that training program is what allowed me to be able to better care for Karen and to work with her physician, to work with her therapist, and to also know from the pharmacist, the kind of meds that she is taking and what may come from the results of taking those meds.
Right. Anybody else want to add anything to the training or the other aspects of the job?
I guess for a long time, we had minimal training in Washington State. And you have these jobs, and people are hired to be the fry cook. Well, they're trained on how to be the fry cook. But they expect home care workers to go in the home and transfer people and hope we don't drop them. And then it's up to the consumer to teach us how to do something. How unsettling for this worker's walking through the door, she's going to take care of me, and she's asking me questions. So the stories had to keep coming out and telling them and having a trained workforce, because we want to keep people in their homes, and you can do it with a trained workforce. And like Regina was saying, looking for the signs and knowing when to get the doctors. Again, what are we doing? Saving money. Comes down to the bottom line, doesn't it?
Just keep saying it. I'm all for that. Well, I want to let everybody have the chance to make a last comment or ask a last question or add anything that, you know, you feel like the audience or I need to hear or respond to. So,
Well, for me, as far as education, taking care of my daughter all those years, I did it my way. But one day I sat down with my husband and I said, you know, I want to go to school for this. You know, I want to learn how to do it the right way because I may have been doing it my way, but I wanted to learn how to do it the right way. So he said, okay, find a school. So I found the school. It cost $500. So he said, okay. So we paid the $500 in installments because he was the only one working. I did graduate from school, CNA. So it helped me to learn how to take care of the consumer the right way. So education is very important because I learned that I was lifting wrong, lifting my daughter wrong. I never dropped her, but I just wasn't doing it the right way. So I learned how to care for the consumer better and the correct way. So education is definitely important. So while we're out here fighting for a higher wage, we also need to be fighting for better education for home care providers. Also.
good for you. Yeah,
Thank
that you
you.
went and did that. That's great. You got the
Yes.
CNA. That's
Yes.
terrific.
Thank
So
you.
I'm hoping you'll get employed again soon.
Oh,
Put
yes,
all
me
that to
too.
work.
Yes.
Yeah.
I just want to make one other personal comment. I want to thank you for sitting down with us today at this table.
Yes.
I think it's very important for us. And we're on the front lines, and we do the job. And I think it's important to sit at the table. Because for so long, home care workers and our job, we are on the menu. And we need to be at the table.
Yes.
We need people to listen to us. We need to be part of the decision-making process for making a difference, to setting the policy. So thank you for letting us be at the table and not on the menu. Thank you. Thank you.
Well, I want to thank you, Secretary Clinton, for giving me the opportunity to share my story. I thank you for listening. I thank you for your input. My son will be in a community college. But I also wanted to say that, you know, the piece about education is important, that we improve education and how we're educating, because when I became a certified nursing assistant and working in the field, a lot of times you have to do what they're called in-services. And the in-services is a sheet of paper that they give you that you read over and answer a few questions and you turn it in, which I don't think is sufficient enough to someone who's been working in the field maybe 10 years and taking care of someone who doesn't require a lift. And then all of a sudden that client gets sick, goes in the hospital, you have to get another client. And then that client has a Hoyer lift. Now, you've had some experience 10 years ago, but you need some hands-on training, you know, to make sure that things are done properly. And one of the things that is really pressing on my mind is that we are able in Cleveland, Ohio, to be able to have the right to organize and become a union so that we'll have these opportunities to improve education so that the care that we give matches what I'm saying, which is it's skilled work. It's not just something that you can wake up in the morning and say, oh, I'm gonna be a home care provider. No, you have to have a compassion and a skill to do this job, and it should be required at a level that requires a substantial pay, you know, because if you're paid a decent living wage, I think that it relieves a lot of stress off of you, so when that you're going into a client's home, you're not overwhelmed with your own issues, that you can go in there with a clear mind and perform the job that you need to perform decent and in order it needs to be done. So I think that I'm excited to be here to have this conversation with you and all the home care workers from around the world, because we're all facing the same issues and we all want to see better, not only for ourselves and our families, but for our consumers. Because the consumer is my whole reason and for being in this field. So if we can move forward in every state, and make it possible that we can increase wages, we can increase the training, we can increase the education, then we can take home care to a whole nother level.
Right. That's excellent. Karen, as the person who has been receiving care, do you have any additional points you want to make?
Well, yes, before I met Regina, I had been dealing with pain.
That's okay.
I had been dealing with pain so bad that I couldn't, I went to commit suicide. And I met Regina and the help that I've gotten, and all that, I don't want to do that. I like to be independent, and I like to make people laugh and everything. And now I have that back, and it's just a blessing.
It is a blessing. Thank you for. I'll move on, you come back.
I have a question.
Yes.
So I'd like to know, what would you do to help our seniors, those that get Medicare and don't qualify for services?
Yes. Well, I think we have to look at the qualifications, because what you're describing is just all too common. You know, we don't do enough through Medicare to help people get the care they need in their own homes. We're perfectly happy to pay a lot to move somebody out of their home,
Yep.
but we're not doing enough to make sure they can stay in their home. So I want to take a hard look at that, because again, it saves money, but it also helps people. It creates relationships like the one you're seeing between Regina and Karen. You know, there's nothing more important than that. So my hope is that we will take a hard look at all the regulations, because I think they're outdated. You know, I just think that we need to shake up how we provide long-term care and home health care, because there was a belief, 10, 20 years ago, that people were better off in nursing homes.
No.
And now we know that's not the case. I mean, it wasn't just that the person didn't want to go in the nursing home, and most people didn't. They wanted to maintain their independence. They wanted to sit in their favorite chair and all the rest of it. But there was this idea, well, they'll be better off because they can get 24-hour care. Well, now we know that's not true. So we need to shift resources into keeping people in their homes, in their neighborhoods and communities. So, and we need to start looking at doing that really soon, because of the large increase in people that are going to need some kind of help. I've got no problem with people ending up with so many medical issues that they have to be in a home, in a nursing home. I don't have a problem with that. My problem is, if you're here, you should be taken care of here, and then perhaps the care becomes more sophisticated as you go, until finally, as the last resort, you go into a nursing home. My mother lived with us for, the last 10 years of her life, and she was in good health. It goes back to the question Regina asked me. She had some medical issues, so she would be in the hospital, but she would be coming out. And so occasionally we would have somebody come to the home to, just check on her. But we provided the care that she needed, and she really didn't need a lot of care, thankfully, and was in pretty good health until the very end. But it is clear that a lot of people don't get to make those choices for themselves because they don't have the resources. So instead of spending all the money that we do on nursing homes, and as I say, they are necessary for a lot of people at a certain point in life. But we should be putting more money on the front end to keep more people at home, to give more people a reason to live and a reason to get up in the morning and a reason to have that smile on their face when you walk in the door. And that's what I want to see us do. And I believe we can come up with a better approach. I also think that the fact that you are now organized in this effort gives that voice that Susan was talking about that hasn't been at the table.
Yes.
It's one thing, you know, for somebody like me to advocate, but I'm not on the front lines. You all are on the front lines. So I'm kind of a cheerleader for making sure you're heard so that people can listen to you. And you know, listening to each one of you, you could go out and be trainers tomorrow. I mean, you not only have the experience, but you have bettered yourself, you've taken the courses, you've learned more. So I think your skills deserve a lot more pay and benefits than are currently being made available to you.
Yes.
And that's what we need to try to change.
Thanks.
So, I told Elizabeth, the fact she says she's worked for 42 years means that somebody was breaking the child labor laws. I just don't believe it. 42 years, I don't believe it.
Well, I did it even before that. I couldn't get paid for it, but I got paid through the seniors anyway. And when I was much younger, I think it was like 13 or 14 years old, I used to go to the bingo halls and stand up against the wall, and they would raise their hand, and you would go to them, and they say, "Can you give me a cup of coffee? Can you take me to the bathroom?" I did it. I got change in my pocket. That's how I started, you know. It was nobody I knew, but I did it anyway, and ever since I did that, then I just kept doing. I did different things. I went in nursing home. I didn't like it. I saw a lot of things that I didn't like. I liked the one-on-one. I went to school to become a nurse, and I'm an LPN, but I choose not to work in a hospital. My setting is one-on-one.
Yeah.
It's at home. That's what I like to do. I mean, a lot of people say you're stupid for not getting a better education. I got an education, but that's not what I want to do. This is what I want to do, and this is all I know how to do. So people complain about that, and I just, whatever, you know. I just keep doing what I'm doing. I said I'll do it till I drop, and that's the way I'm going to be. I know that already.
Yeah.
So
Yeah.
that's it.
Well, you're doing what you love.
That's right.
A lot of people can't say that.
Exactly.
Right,
So,
exactly.
you know.
Along with the hardship comes a lot of heart, warming
Yeah,
experiences.
Exactly. You know, I don't get the chump change anymore. But in reality,
Well, you can go hang out at the bingo parlors again.
Yeah, why not?
Why
you know?
not?
But I mean, it gets to that point. I think about how I started chump change, and I'm like 42 years later. Well, really, it is chump change compared to I mean, I should be making more money.
Right.
You know,
should be.
but I'm not. You know, for 22 years, I haven't gotten a penny raise. I mean, come on.
That's just wrong.
That's
Well, one of the things I'm trying to do in my campaign is to put raising wages at the center of the economic agenda, because it doesn't do us any good if everybody doesn't get more in their paycheck so that they can do more with their lives and make choices that give them more security. So we've got to tackle that. That's the goal.
That's it. You know, I'm like, I'm done. Everybody goes, oh, but you don't have nothing to show for it. That was my
You got
choice.
great stories.
Exactly. Exactly. I mean, look at all the people that I took care of, all of them that, have passed on. But I mean, it's okay. They went home peacefully.
Yeah.
They died in their home, and they were blessed the whole time. So I can't complain.
Well, there's no doubt in my mind that you all will be in heaven taking care of people. Probably, need some extra attendance, right?
Yeah. A lot of TLC.
Summer.
Yes.
So, you really have had a challenge with your husband too, haven't you?
I have.
Yeah. How long has he had MS?
He was diagnosed about 6 years ago, and he would have episodes occasionally, but always would come out of them. And about a year ago, he graduated from college, community college, as a mechanic, and 2 months after going to work, finally found a good job. He called me one day from work and said, I can't walk. And he couldn't get the words out, that's all he could say. So over the last year, his health has declined. At the moment, he's stable, so that's very good. But one thing I want to touch on is as a family member of somebody who receives services, even in the position that I've been in as a leader in this campaign to form a union and knowing firsthand about home care, obviously, it was really hard for me to find somebody that I could trust to come into my home, somebody that could take care of my husband, that I knew could do the job well, that was trained, and also somebody I have 4 children, somebody that was going to be in my home around my children. It took me a long time to get to the point where I said, okay, I can't do this anymore. I need to have a reprieve. It was really hard, and luckily we found somebody that worked on the campaign with us. Her client passed away suddenly, she needed a job, we needed a PCA, and it's worked out really great, but the challenge of finding somebody that I knew could do the job and I was comfortable with was really, really hard, and that shouldn't have been a worry, that I should have been able to go somewhere and say, this is what we need, and to know that that person coming into my home can do that, and that my family is comfortable with.
Right. I think that's a very important point, because it's not just anybody who's good at this work. And it's not just anybody that you can trust in your home.
Yes.
That's part of what, the union, the training, the vetting, the support, all of that can make a huge difference, because you ought to be able to call and get a recommendation that you can trust. Is your husband on disability?
He is on disability.
He is on now?
Yeah, he just got approved a couple months ago.
That helps a little, doesn't it?
It helps a little bit, yeah.
And what is the source of the payment for his home care?
Medicaid. Yeah, fortunately, we have health insurance in the state of Minnesota, or else I'm not sure what we would do.
And are your 4 kids are all insured?
Yes, yes.
Are they're all healthy?
They're all healthy, yes.
The other point I want to underscore, when Summer said that she got no paid time off, I am really adamant that we need paid family leave, we need paid sick days, we need to be sure that people get the support you need. And the idea that you had to go back to work in 5 days after each of your cesareans is just unbelievable. Unbelievable. That is major surgery.
Oh, yes.
And when people in the political world or the business world, wherever they come from, oppose these programs, I would like them to just walk in your shoes for a week.
Yeah.
A day. Give them you're right, they probably wouldn't last longer than a day. No, I know. I mean, you've got people, well, let's just say you've got people running for president who, I don't know what world they live in. I don't understand it. It's truly amazing to me. I'm constantly in a state of disbelief. They said, what? But this is serious, because it really is about people's lives. And we make it just about as hard as we can imagine for women in general, and women with families in particular, to be able to work and take care of their families. We make it so hard. And I am determined that we're going to finally join the rest of the advanced world and start providing the kind of support and benefits that hardworking women who face the challenges you face, Summer, and all the rest of you, are going to get some help. It's just wrong. So, Regina, you had the first word, you get the last word.
Having the last word is to say that we really do appreciate you taking time out to listen to all the stories from all of us that are home care providers. I'm glad that you understand us. I'm glad that you see what we go through on a regular basis. I'm glad that you know that we're just not babysitters.
That's right.
We're not only, a portion of our titles is care, we care about what we do. We care about the services that we provide. We care about having education so that we can know that we can provide these services. How do I want to say, safely?
Yeah.
Yes. None of us have been planned to cry. I know that I didn't want y'all to see me tear. It's just that we are emotional because of the fact that we know that the work that we do, saving lives, caring for someone's life, is in us. And you said something that hit me to my heart. My husband is a pastor, and I know he loved when you said this. When we go to heaven, we will be doing the same kind of care.
That's right.
And so again, we thank you for listening to all of our stories. We thank you for the support we've heard from you today. And it was an honor to have you in our presence.
Yes.
Let the congregation say.
Amen.
Thanks to SEIU for putting this together and bringing these amazing women here so that more people can hear their stories and also see how fortunate we are to have people who have devoted their lives to caring for others. You know, at the end of the day, I don't think anything matters more. And so thank you. Thank each and every one of you.
Thank
God
you.
bless you.
Thank
you.
He probably heard you.
Summer, I hope that